Hey everyone, welcome. We're glad you're able to join us today. We are going to be covering HIPAA and the new normal. So it's going to be about HIPAA, COVID, and the new normal. Our presenters today are Will Nobles, who is the founder and CEO of Vector Choice, and Paul Redding, who's the VP Partner Engagement and Cybersecurity of Compliancy Group.
Alrighty, guys. So I'm going to just introduce Vector real fast and who we are and what we do. So we are an IT managed services company based out of Atlanta, Georgia. We have offices in Baton Rouge, North Carolina, and Washington, D.C. And we services clients in multiple countries as well as across the United States. We have had the honor of getting the Inc. 5000 2 years in a row, and also the MSP 501, which is the top managed services providers in the country, and plus several other different awards. Our clients say a lot about us, and Paul, go to the next slide if you don't mind. The things that we do, we provide hosting services, managed services, outsourced IT. We can be a part of your IT department or your whole IT department. And we have the ability to service from phone hosting to hosting servers to complete managed services and all the cybersecurity aspects around that. So I'm going to turn it over to Paul and let him introduce the Compliancy Group.
Thanks a lot, Will. And again, thanks for having me today.
Not a problem.
Like Will said, I'm Paul Redding from Compliancy Group. We are a Vector Choice partner. Compliancy Group is a 15+ year player in the healthcare space. If you haven't run into us, you've probably seen our seal of compliance that's pictured here. Our seal is endorsed by more than 40 major medical associations. So for example, the American Optometric endorses our seal as the preferred way for their partners to illustrate their HIPAA compliance. Something that we're really proud of about this seal, HIPAA in healthcare is a very tough space to be in for a lot of people. We've simplified HIPAA and made it in such a way that you follow our process and our procedure. We have developed a methodology which absolutely ensures you can do everything under the law to achieve HIPAA compliance. We issue our seal of compliance at the end of our process, and we're proud to say that no one that has ever achieved that seal has ever failed a HIPAA audit. Doesn't mean that bad things don't happen to good people. Unfortunately, they do. Some of those people have been our clients, but by using our methodology and following our processes, we've been able to prove a good faith effort under the law, which is all that's required to prevent a HIPAA violation. Today, what we're going to be talking about is, hitting the new normal, right? So we had the major, COVID outbreak. It upended businesses all the way across the country, obviously including healthcare, maybe especially healthcare. Some things have changed around that, and as, let's call it, thought leaders, the Compliancy Group is a resource for a lot of people in healthcare for information. So during those first months, our phones just blew up. Everybody calling to say, has HIPAA been suspended? How can I do telehealth safely? How do my people work from home in a HIPAA compliant way? We're going to hit all that stuff and kind of try to some of the mystery around this whole post-COVID HIPAA era, and give you some pointers on what you actually need to do in order to maintain compliance with half of your workforce, conceivably not in the office on a daily basis. So to kick that off, I think I want to start with the big one, right? What changed? Because like I said, right there in the very beginning of this outbreak, the president got on TV and said, we are relaxing HIPAA requirements. And of course, everybody heard what they want to hear, right? Which is, there's no more HIPAA, right? Oh, great, I don't have to worry about this anymore. Nothing could be farther from the truth. In all reality, a lot of what changed has nothing to do with IT or even the administrative functions inside your office. They made it easier for people to see doctors across state lines. They made it where you can now basically do telehealth for anyone, anywhere in the country. And they made it easier to waive Medicare beneficiary cost sharing. I can hardly say that. Doesn't really factor into your daily life on a huge basis. What they did do, however, and this is a tricky one, they said, because we recognize that everybody's got to start to do telehealth, and there's only a handful of HIPAA compliant platforms out there, for right now, during this emergency and until further notice, we're going to waive your requirement to have a business associate agreement in place with your telehealth provider. So what that meant is before HIPAA, or before COVID rather, let's take the platform we're on right now, Zoom. There was a non-compliant free version of this solution, a non-compliant, reasonably like 20 bucks or so version. And then there was, you got to pay 200 bucks a month or up, or you can be HIPAA compliant. What they did is, recognizing not everybody could jump onto that more expensive platform at once, or basically would crash the servers, they said, use whatever you want as long as it's not public facing. Now, I want to emphasize that does not mean TikTok. That doesn't mean, whatever your teenager is using, your, like Facebook, right? You shouldn't be on Facebook Live doing a telehealth session. But they did say things like Apple's FaceTime, for example. The free version of Zoom. Anything that's not public facing could be used. Now, Will, you and I both know that can and should are like two wildly different, right? So can you use, can you use the free version of Zoom? Conceivably, yes. I will warn you that a doctor in San Francisco was doing exactly that, and he was a mental health professional. His patient's whole session ended up on YouTube. So can and should are two different things. Is the doctor going to be fined millions of dollars for that? No. Would you use that doctor? Absolutely not, right? His reputation's forever damaged, and the patient suffered irreparable damage himself. So what does that mean, right? Well, it means this is a slippery slope. They're not going to do you any favors. They're going to tell you what you can use right now. But did anybody get a letter out there saying, hey, go ahead and do this? No. It's like an announcement on TV. If you're paying attention, there will be another announcement on TV at some point that says you can't do it anymore. And if you weren't paying attention, you will suddenly be in violation of the law if you're using the wrong platform. That's why people like Will put you on platforms that are compliant to begin with. Now, there's one more thing I want to hit here, because this happened literally, I want to say last 7 days. They've changed one more thing about the law. And again, everybody heard what they wanted to hear. There's no more business associate agreements at all. They said the other day the requirement for business associate agreements is suspended. I saw it on CNN. No, you didn't. What you saw on CNN is another very confusing announcement that what it really meant is there are, and I don't want to get deep into this, we'll hit it later, but there are covered entities. That's you if you're a medical professional. And then there are business associates. That's Vector Choice, Compliancy Group, the people that work with you. Historically, the only people that are supposed to be sharing PHI are covered entities. They have now made it capable, or they've made business associates capable of sharing COVID-related data for contact tracing. So if you're a business associate in the business of tracking COVID symptoms and data, and you must release this data under certain circumstances, you don't have to get a BAA with the tool that you're using. I'm going to ask like a rhetorical question. How many people on this virtual room does that apply to? Probably not very many of you. If it does, it's only in relation to that COVID data, and everywhere else you work, you would have to have a business associate agreement. So not to belabor the point, but if you're a doctor and Vector Choice is your IT, then you have to have a business associate agreement with them, and nothing that I just said has any bearing on that relationship at all. Now, Will, do you think that you're like me, right? I don't think most people get this. You hear what you want to hear, right?
I think anything with the news, you hear what you want to hear, and that is the bad of how fast this information is coming out with COVID over the past 6 months. It's just thrown at us, and I think hearing this from experts like yourself and people that work in the roots of it every single day is definitely good to hear, for sure.
The reality is, man, there's 7 fundamental things that Health and Human Services have told us we have to do. There's a 1,000-page document that details what these 7 things are, and they're never, ever going to change. They're not going to suspend these. They're not going to weaken them. There are little issues here that they're going to try to work with you in these emergencies. They've done it before. The same thing's happening, by the way, with the hurricanes right now. They're releasing, they're alleviating some of the burden that HIPAA places on emergency action. That's all they're doing. You're still expected to do all your policies and procedures and contracts. And by the way, all that IT stuff that, when we say compliance, everybody out there goes, well, I mean, I've got a firewall, I'm compliant, right? Look at the 7 fundamental elements they give you and show me where IT is. Most people can't do it because it's buried inside 5 or 6 of these. The monitoring, logging, and auditing, for example, Bill can sit here and explain to you what that means. It's going to go right over your head. There's a ton of tools that he's using to be able to tell who did what inside your organization, and it's legally required. It goes back to why free Zoom, not logging, monitoring, and auditing anything, is not HIPAA compliant and unsafe, whereas Microsoft Teams, full accountability, full tracking, and encryption is. Now, the stakes have never been higher, guys. Why is everybody coming after you? Why is everybody talking about HIPAA in the middle of a international crisis? Well, you in healthcare, whether you're a business associate or a covered entity, all of you make up almost 30% of the US economy, and this was before COVID. This was before the implosion of the hospitality sector, before the implosion of the service sector. Those two sections alone are going to bump this up. We'll see healthcare at well over 35% of the US economy in 2021 and beyond. More importantly, though, finance and manufacturing make up huge chunks of our economy too. But finance and manufacture, if you look at what they really are, there's a very, very few very large businesses at the top of a pyramid that do all that revenue, and a few small businesses kind of supporting that form of like downstream vendors. HIPAA is the opposite kind of a pyramid. There's 5 million small and mid-sized businesses that make up HIPAA. Privately owned, under 250 user, but call them mom and pop shops that make up this huge section of the economy, which means, I'll give you an analogy. Which is easier to rob, a liquor store or a bank? Look, I can rob 16 liquor stores before I can get away with one bank robbery, right? Hackers know this, man. Why are they going to go after, Chase Bank when they can go after Dr. Smith? The odds are Dr. Smith doesn't have a red team and Dr. Smith doesn't have advanced IT. It's an easier, lower hanging fruit. And because there's so much of it, you'll hit 16 doctors instead of one financial services group. Now, Will, is that what you see?
Oh yeah, a lot of times I hear, my clients or prospects say, well, I'm a small doctor's office. I'm only one doctor or two doctors. I don't have anything for them to steal. Talk about that a little bit, about the risk that even the small, I don't care if you're one doctor's office, and so much of HIPAA has, from the doctor's perspective, has been blown out of proportion, and they're like, HIPAA this, HIPAA that, I don't care. I'll take the fine over maintaining HIPAA compliance. Talk a little bit about that and the risk for the doctors.
Well, the risk is growing. If you asked 5 years ago, 6 years ago, when I was running my MSP, I would have immediately started talking about ransomware and, the fact that they can lock up all your files. And that stuff is scary. It affects your business, it prevents you from functioning, and it ends up in some fines. But in reality, the data that doctors are working with, and it depends on what your specialty is, can go way beyond just, me getting a credit card in your name. Sure, you've got my social security number, you have all this personal information about me, but you can actually control things about my life people don't think of. For example, recently, we've seen a study that shows that a hospital that experiences a major breach has a major increase in the death rate among their heart patients for the next 2 to 3 years. Literally, people die because they got breached. Now, why is that? Think about your patient records and how critical those are for so many Americans that live and die by their medication, by the treatments that they're under. We are a medically supported society. So there is, if you want to unravel that, or you want to take an attack at like the larger society as a whole, this is a place to pick us apart. But even at the smallest level, I'll say it again, you're easier. You're easier. I can get in there, take advantage of you, run away with the data. And, I said in the beginning, like back 5 years ago, I'd have talked about ransomware. 5 years ago, I would have told you ransomware, if you have good backups, is not a breach. I said, don't worry about it. Look, as long as Will has come in here and he's backed up your data and you get ransomware, he's going to tell you not to pay the ransom. You're going to restore the data, get it right back. No harm, no foul. The problem is now ransomware has become like burning down the house with the body inside. It's not a house fire. It's a homicide. They went in, They got all your data, they copied it, they exfiltrated, it's what we call it, right? They took it away, they had a copy there, and so it's just a ransomware attack, they block it all and they ransom you, and if you pay, they don't give it back anyway. It's all gone. So people like Will, if you're not, really sharp and on top of it, if they're old school and they go, oh, hey man, it's just a ransomware attack, you missed a major breach. It takes a real professional, somebody like Vector Choice, that keeps their nose to the ground and understands this to even determine what happened to you in the face of an attack. So why small doctors? Because the odds are I'm going to get you, I'm going to get your data, and I'm going to get away with it. Now, I'll give you a really scary one to me. Israel recently in a lab, they have discovered a malware that has been built to alter imaging records. This is now hacking humans. I am no longer just hacking your data. I am no longer stealing your identity. I could actually conceivably affect your diagnosis. I can add a tumor. I can remove a tumor. I can add a break. I can remove a break. This has been done so well that real doctors on viewing the altered results were fooled 99.8% of the time. There's like 1 out of 1,000 images that they're like, ooh, I don't know, that looks weird. The ransomware is getting smarter. And why would you develop something like this? Because we're moving to a place where it goes beyond just the finances of it. We are going to start hacking society, and you in medicine, you're right there. You're the society we're going to hit. Now, I just said something kind of weird to people, I think. They heard me say 30% of the US economy is healthcare. I said it, but I'm going to hit it again. I did not say 30% of the economy are doctors, okay? If you even remotely touch the data, you are in healthcare too. That means Vector Choice is in healthcare. Compliancy Group is in healthcare. It means your shredding company, your printing company, everywhere that your doctors. Think about the accountants that you work with, the billing systems that you work with, all these things, your business associates. We collectively make up healthcare. So to answer your question, I guess in a long-winded way, it's some of the best and most sensitive and easily accessible data in the world. It's low-hanging fruit with high value. And guess what? If you screw it up, everybody's going to know. Because one thing that HIPAA is not is private. The violation, you violate privately, guess what? You are going to be exposed publicly. We call this the wall of shame. That's what it's called. And you kind of informally, it's called the HIPAA wall of shame. You can Google it. The URL is right there. If you screw this up, your name is going there, just like these poor people. We picked some from about a year ago to hopefully make sure that nobody watching today's name popped up. But I will tell you that I was at a major medical association event. My CEO was doing this. He put up the wall of shame, and from the back you heard, oh, crap. Turns out somebody in the room had bought a clinic and their name was right here on this board. They were undergoing a major audit. Guys, you can't hide from HIPAA. If you mess it up, they're going to know and they're going to come get you. Now,
So,
go ahead.
What's the so number one, if you guys have any questions, please put it in the Q&A down at the bottom or the chat, and we'll get to that at the end of the webinar. But also, Paul, if someone does get compromised, let's say they get a ransomware and they don't report it, what are the fines, and what's the risk to the doctor's office or hospital system at that point?
That is a great question. Well, first of all, there's really two kinds of breach, okay? There's under 500 medical records and there's over 500 medical records. If it's under 500 medical records, you've got to the end of the fiscal year. You've got to report it. You're going to have to turn it in, but you get a little bit more flexibility. It's considered basically, let's call it a minor breach. When you get over 500 medical records, you have to report it immediately. You are required under the law within 30 days to take this back to them, give it to them, and say, hey, this is what took place. This is what we understand happened. And if you do that, bad news, there's going to be an investigation, okay? There is no incident without investigation. So everybody out there understands the bodies that are doing all this around and to you. There's Health and Human Services. These are the people that write the law. These are the ones that actually issue the fines. These are the ones that review what happens after. But there's also the Office of Civil Rights. You have a civil right to privacy. And anytime there's a violation of that, i.e. a breach, they are legally obligated to do an investigation. So first of all, if you wait or you don't report, you have already violated a law. They're going to begin, and the average HIPAA fine is $1.5 million. You are willfully negligent. You have hidden or obscured, obfuscated from the law, and they're going to start by fining you for the non-reporting. But then, of course, the audit is going to go really badly for you because they know that you're hiding stuff. So they're going to pick apart everything they can. The worst thing you can be in HIPAA is dishonest. It's better to say, I don't have any policies and procedures. I have none. Okay, well, there's a fine for that. If you say, here, I bought these policies and procedures on the internet, and they look at them and they don't reflect anything you do, then you're lying. Everything on there is something that you told them that you're doing that you're not, and they individually fine you for all. So the reality is, if you try to hide, it just gets worse for you. My dad used to say, don't lie about it, son. You're only making it worse for yourself.
That's very true. Very true.
Now, I did a lot of gloom and doom, and I want to pull everybody back for a second. This law was not passed as a punishment for you becoming a doctor. They didn't do this to you because they're mad that you want to help people, okay? The reality is the financial sector got hit first years and years and years ago. They learned from their mistakes, and because they are the financial sector, they put in all these laws and all these regulations, and so they kind of tighten things up. HIPAA was designed to help the small business medical sector do the same thing. If you look at what the requirements are, let's take away all the doom and gloom if you don't do what they say. If you do what they say, there's actually a lot of benefit to your business. Any business in the world, whether you're in healthcare or not, is going to benefit from at least annually taking a look at every way you can get hacked or whatever risk there is to your business. Taking a look at yourself and saying, how am I vulnerable and what do I need to do to protect myself? It should be a normal function of all small business, of all business, period. I know where my weak points are and I try to fix them. They require you to do that on an annual basis. They also require you to tell the people that work for you what their job is. Unhappy, poor employees have no idea what their job is. They feel everything's their job, nothing's documented, and they make mistakes. People screw up when you don't give them guidelines. HIPAA requires that first you as an organization define what everybody's supposed to do, and then you tell them and repeat it and you train them. You make your employees better, which ultimately builds a better corporate culture, right? I mean, think about it. I know where I'm weak. I know where I'm strong. We're always striving to correct where we're weak, and we're always fixing what doesn't work. My employees all know their job. They understand the requirements on a daily basis, and privacy and security is in the forefront of their minds. If you guys do this stuff, you look like Vector Choice. People want to work with you. You have a corporate culture that bleeds out into everything you do, that shows that you're concerned about security, you're concerned about privacy, your employees are well trained. We've shown time and time again, compliant businesses have an increase in patient or customer loyalty and ultimately become more profitable because you look like a better business to work with. I want to go to a doctor that cares about my data. I want to work with an IT team that cares about my data. If they don't care about the small things, dude, what about the stuff that I don't see in the background, right? It improves your business. Wouldn't you agree with that, Will, that like compliance actually makes you stronger?
I really it does. It's even with our company, just when we implement things, it feels, hey, we're doing the right thing. And I think that's a lot of healthcare companies. Either they don't realize what they need to do, or sometimes they just, and I hate to say it, but they just don't care about doing the right thing. And the way I actually I was sitting down with a pediatrics doctor, and she was like, oh, hell, HIPAA, I don't care about that. We all use the same login here at the practice. And I'm like, do you care about the kids that come in here and see? Yeah, I do. Okay, well, if you care about them, you should care about their information as well. And that changed it for her to realize and say, you know what, you're right. There is, I need to care about the whole big picture. And I think that's at us at Vector, just caring about the big picture, because we're so responsible for so many different types of networks. We're hacking wise between healthcare and us, it's amazing how much we're attacked as a managed services provider, because we have the keys to everybody's kingdom. And so we have to take it to the next level when it comes to security.
And well, that's a great point. I'm glad you said that. Working as I do, I have kind of two hats, right? I wear the cybersecurity hat, and then I work with service providers like yourself. I'm probably your closest liaison in Compliancy group. That means I see a lot of people in your space. I'm going to tell everybody here, not all managed service providers are created equally, okay? There's not a barrier to entry out there, folks. So there are guys that have this, and ladies and gentlemen out there that have this and really get it and are striving to do the right thing. And then there are service providers exactly like that pediatrician you just described. Hey, my house in order. If I get hacked, I got cyber liability insurance for it anyway, so I'm covered. They're not thinking about the damage done downstream, first to their doctors and then to their doctors' patients. This is not a you get to, you get to carry your own risk. It's not your risk, it's everybody else's. That's the thing that people don't understand. And I'll tell you what, there's a 94% failure rate. I'm a cynical person, but I don't believe that 94% of businesses willingly neglect this because they don't care at all. I don't think they understand the stakes, and I don't think they understand what the law actually requires them to do. That's the difference.
No, I agree. I agree. And Paul, when it comes to, what they need to do, what are the things that a doctor's office really needs to focus on, and what aspects of them? Is it all of it? Is it just the paperwork portion? Is it the actual security? What should they be focusing on?
Compliance is a marathon without a finish line. Okay, there's a lot to be done on the way. You as you run this race, there's a methodology to doing it, but it really is a process that begins with assessing your risk, defining your environment, and then it becomes a wash, rinse, repeat through a series of audits and training. So one thing that I tell everybody is if you're only doing part of it, then you're completely negligent and exposed everywhere else. Unfortunately, compliance is just like, I'll give another great analogy here. It's like Algebra 2. I only failed one class in all high school. The first time I took it, I failed Algebra 2. The reason I failed it is because I couldn't show my work. I was a shortcutter, man. Every time I saw a shortcut, I thought I was smarter than the book, and I jumped ahead and I gave the answer. My answers were right, but my work was wrong. So you could actually come out of this thing today and say, I didn't hear anything at all that I've not done. I've done absolutely everything this dude says. You've got to be able to prove it within 10 days of an audit request and prove it 100%, or you might as well just throw in the towel right now. So it really is kind of an all or none thing. For example, in telehealth, I'll kind of bring back to, like, let's say, we talked about what's changed. Telehealth is just like everywhere else you've ever worked. It's just like your office. It's just like your remote workers. I told you those 7 fundamental elements don't change, right? So in telehealth, there's either ones that will sign your business associate agreements or ones that don't. We established in the beginning, right now, if you're feeling brave, you can kind of use anything you want to. I don't recommend it. I wouldn't do it because at its core, what you're missing are all required controls, okay? In HIPAA, they require you to have access controls. By the way, this goes back to that pediatrician you just talked about. Guys, shared accounts are no good. You can't have one Zoom user for everybody in your organization to trade around telehealth. Who is it that listened to this person and leaked their information? I can't tell. The same thing is true with your office anywhere you go. Access control means who did what, when, and where. Endpoint protection. Well, is antivirus what I need on my computer to keep me safe? Is that I got Norton? Am I good?
Yeah, antivirus is just one of many things that you need.
We call it endpoint protection now. The reason being, if you go look at Health and Human Services guidelines, they quit using the word antivirus as what you're supposed to install. What they're telling you is protect the thing you're using. Back to the telehealth platform, Free Zoom isn't doing this. They're not tracking who did what. They're not worried about a hack against. Everybody heard about Zoom bombing. It didn't happen on Enterprise. That's not the version that they got to hit, right? Because there's no monitoring, logging, and auditing. But the big one that just popped, encryption everywhere all the time. If you have ePHI, you are responsible for making sure that if I get a hold of wherever you put it, it's useless to me. An encrypted laptop. Go ahead.
So Paul, this brings up a good point that I get all the time. I get customers and prospects when I'm sitting down talking to them about HIPAA and their security and what they need in place. They always go back to, well, I use a hosted EMR system. So my EMR system's in the cloud. I don't keep data on my local computer. So why do I need this? How's your answer to that?
You saw the eye roll right there. That's where I began, is with hoping I'm not on video and a quick eye roll. Um, so can and should are two different things. When you use a clouded EHR, you should not have local EPHI, but you can. You can screenshot it. You can bring it down to print. If you print locally, you create a temporary copy. Somebody can email it to you where you can open it. Where does the data that goes into the EHR live? How did it start? And realize that one little mistake, one action, not necessarily on your side, but on the side of somebody else, can end up with PHI anywhere. We call that EPHI bleed. I'm going to go ahead and pick on your competitors again, Will. So I get that question a ton from MSPs that just don't get it. They'll come to me and go, look, my client has all the EPHI data. All the thing I touch at all is I provide a backup service that goes through a vendor. So the vendor now takes that EPHI data and all goes to their data center. I should not have to encrypt. I don't have an EPHI. What about, and I'll give you an example that happened to me years ago. What about when your customer makes the mistake? You can't prevent that. I had a help desk agent when I was running my business one day, walk in, shaking his head and look at me and goes, look at ticket number so-and-so. This doctor had consistently had this annoying thing happening in Outlook, and he kept getting this Outlook error pop up. So he screenshotted his Outlook when the error popped up, and he attached it to a ticket, and he sent it to my entire company. But Outlook previews the email that you're looking at, right? So there is an open PDF with somebody's entire medical record. Like, he is in the process of reviewing their record. Everyone in my organization just got it. We used a client on our computers to work our tickets. We all now had it on local machines. Everybody all at the same time. That can happen to you. You can do the best thing in the world, and one of your patients gets your email, fires it off to you, and you download it locally. Now you have EPHI. The law does not forgive you for saying, hey, my customer screwed up, I shouldn't have had it. There's encryption. If you buy the right system, turn it on. It's something you've got to have. But no, man, people try to get around this all the time with the idea that because I shouldn't have EPHI, it means I don't. It's not the case.
Yep, and that's what I preach every single day.
And you know, I'll actually throw one more out there. We talked about telehealth and, you know, all the sensitive data. So for everybody that's not a doctor, and I know we have some business associates out there like watching, you went home to work too. The reason you're still supposed to pay for your video conferencing system and use something compliant is this is my team right here. We didn't have, and this is a very small portion. We're about 36 people when we shot this. And everybody see me down the bottom right doing the 90s what's up sign. So we didn't have these big everybody in-house meetings every single day like we do now. When we sent the whole team home, we had to really increase our, kind of call it virtual FaceTime, to maintain a cohesive corporate culture, right? Does that mean that every single conversation on every one of our team's meetings or our Slack meetings here needs to be broadcast on YouTube? I'm not saying we're a nefarious company doing back shady deals. I'm saying this is the inner workings of my organization. Do I want people watching and streaming what we do on a daily basis? No, I don't think anybody out there does. So back to can versus should, everybody in a business environment that's not directly under HIPAA or is not doing telehealth can use whatever they want to. But I'm here to tell you right now, the difference in a secure platform and a freebie is one of these days you might be clicking on YouTube and find yourself there saying something incredibly embarrassing, and you'll never get that moment back.
That is very true. That is very true. So, you know, and this goes for not
Now,
just this goes for just health. This goes for all kinds of different types of companies that, you know, using free stuff, you get what you pay for. And this is outside of healthcare as well. So.
Right. You get what you pay for. And let's be honest, you can't buy your way completely out of a hack. That actually leads into my next point extremely well, because most of the time a breach starts, it wasn't the technology that failed. The most common methodology for invading someone's systems and breach is email. Okay. Email comes like the vampire in your house. Everybody's seen the movies, right? So I can hang garlic on the windows and I can put crosses on the door. But if I met the vampire at dinner and invited him into the home, he just comes and goes as he sees fit, right? That's kind of the way email is. Your weakest link is what we in the IT community jokingly call layer 8. It's you. Human beings do dumb things. Most breaches start with somebody doing something bad. They lose their phone, they open a port, and they're an IT department, by the way, like a huge of this is actually your IT department screws up. Back to not all IT people are created equally. Human error can actually circumvent almost any IT security mechanism you put in place. So if you're not, back to you asked, do I have to take care of all of it or can I just do some of it? Well, I mean, let's say the sum of it you do is you call Will at Vector Choice, you say, make me HIPAA compliant, but I only want to touch the IT portion. Awesome. He can keep you from getting hacked all the way until you have a bonehead employee. And by bonehead employee, I'm going to pick on somebody now. See this guy right here? Look very self-satisfied and sure. He just got a great job this day. He took this, he posted it on his LinkedIn, he posted it on his Facebook. He was so proud of himself because he was taking over the emergency management system for the state of Hawaii in their IT. The problem is he couldn't remember his password. So he has it stuck on his screen in his Facebook. Does everybody remember when all the Hawaii alarms went off because they thought North Korea was nuking them and an entire state freaked out? Whoops. Now, what did they have to do to fix this? Could Will's technology on in here and stop this hack? Dude, I got to break it to you. No, there's his username. There's his password. Right behind him on the screen is the URL. Like you are in. You are this person. But the catch is a well-done risk assessment. If you had paid Will to come in and do the risk assessment, he'd have walked around your office and said, whoa, 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 what is this? And if people did a risk assessment consistently, and if there was a corporate culture of compliance inside the Hawaii Emergency Medical Association or the emergency agency here, that wouldn't have flown. You don't think somebody had walked by and saw this sticker before, but they didn't have a corporate culture of compliance. He's just proud he got a new gig. And in case you think it won't happen to you, these are small businesses, guys. These right here, this is not Kaiser. This is not Baptist Memorial Hospitals. And this didn't happen because some nation state actor from North Korea spent 16 hours breaking into their systems. These happened because COVID hit. People had to go home from work, and the businesses they work for did not do risk assessments and implement the right policies and procedures to control their employees. In the first case, somebody lost a laptop. Had 50,000 medical records on it. You notice they're not calling out whether or not the laptop was encrypted because they got fined $750,000 before that question even came up. You see, they didn't do a risk assessment that year and they didn't have teleworker policies and procedures. Nobody told that employee what their responsibilities were when working from the house. Like, I don't know, don't leave the hospital laptop in the back seat of your car. That might have been something important for her to know, right? Like this other, and unfortunately we're picking on two young ladies here. In the second environment, this young woman is leaving her husband. They're unfortunately experiencing a divorce, which means he's no longer her friend. And since his ex-friend left a huge box of medical records in his car, he thought it would be important to notify somebody. So he did. He didn't sell this data. He didn't commit any crimes. In all reality, I guarantee you the guy didn't rifle through these people's information. Instead, he, back to your point, what causes an audit? Dude, he sent it right there. He called somebody and said, should I have all these medical records? They were not fined for any IT whatsoever. They were fined because nobody told her, come hell or high water, physical medical records don't go loose in a box in a car. It's not how we transport stuff. It's not what we do. So without a true accurate risk assessment, it always comes back to the same thing. You can't determine whether or not you're compliant and you can't determine whether or not you're secure and safe. It's impossible, right? That means yes, in a home environment. Both of those happen in a remote work from home environment because like many of you out there, COVID hit and you went, nobody come to the office tomorrow. I don't want to get sick. Okay. Well, did it occur to you, you haven't done a risk assessment at all those employees' houses? When I talked about what changed in healthcare, did you catch the part I didn't say they suspended the requirement from a risk assessment where you work? Nope, gotta have it. Now, Will, did I just tell you that that means you have to send your employees to the home of everyone out there during COVID? Like were your people in masks and boots?
No. We can do remote assessments. And really, we're just looking at and I'll step back to us. Even when my people working from home, we actually provide a firewall, a small firewall at their home that they're isolated from their home network. Now, you don't have to necessarily go that far, but some of the basic things like changing your modem. If your Comcast modem is default password's admin admin, and I can Google what your modem password is, just by Googling it real fast, then that's a problem. We can really jump on either a machine at the house, if it's your home machine, and we can look at those things and determine if you meet those requirements or not.
Right. And, one thing I'll add to that, because you can give the guidelines, but there becomes a responsibility for the clinic to kind of expound on this. When you assess an office, you say you bring Will's team out and they do a physical site assessment, some of the questions they ask are about how you function from a privacy perspective, right? So think about what Will said. Okay, so his guys come in, they do a remote assessment, they make sure that all the passwords are safe, your employees have like actual antivirus on their computers, they set up what's called a VPN. If you don't have a firewall like Will did, you have to have a VPN. You have to be able to encrypt the traffic, you have to secure it, you got to work with somebody like him to secure the session. You can't just say, oh, well, I don't want to put $1,000 firewall and I'm going to do nothing. There are things that have to be put in place. But one of the things you got to consider is your family is not trained to respect your privacy at that level under normal circumstances. Before you send some, huh? Or at all, right? All right, I have little kids, or at all. Prior to COVID, walking into dad's office and grabbing an ink pen out of the desk drawer was not a really big deal. Now that dad is sitting there doing a telehealth session or might have medical records out on that same desktop, if that kid can read, we have a major problem here. So I see these cute memes all the time of like husband and wife working next to each other with their monitors pushed together. This is the new normal. Not in a HIPAA compliant world, it ain't, because that one needs to be facing that way and that one needs to be facing that way. And if you get on the phone, you all have to separate. A big one that my next door neighbor, I'm going to pick on him. My next door neighbor works for a Fortune 100 company. It's a massive, massive organization. I heard him out back one day doing like pipeline reviews with executives on his phone while he barbecued. I heard some very interesting numbers very loudly. He wasn't happy about what he saw. I wonder if he realizes he just broadcast the financials of one of the most recognizable companies in the world to anybody within earshot. Now, in his case, I think that's maybe a Sarbanes-Oxley violation. If you're a doctor, you just massively violated my privacy. You just massively exposed something you can't. So human privacy, yes, that of your patients through telehealth, but think about who told your employees what their job is. And by the way, if it's not you, then you're liable for this, okay? You have to train, you have to put the policies and procedures in place to tell them what they're supposed to do. Now, visually, I kind of like what you said there. You don't have to have a firewall everywhere. I put this up because, guys, this is what your home office is supposed to look like. We call it edge security, some kind of network management, like you have a router, but make sure people just can't jump into it. You have to have wireless password. Know your neighbors. Like before, you didn't care if they're using your Wi-Fi. You do now. You're doing telehealth, right? So Will's people have to look and go, dude, you have no password at all on your Wi-Fi. This isn't going to work. Tell everybody in the house they got to put in a new number, right? Same thing with, we talked about endpoint protection. You have to have something on the endpoint device and you must maintain encryption. Just because you sent them home and you didn't want to buy everybody a Surface Book to go with them, I get it. I get it. You have 50 employees. You can't spend, buy an individual computer for each of them. Everybody worked from desktops before. But we can install relatively affordable software, make sure it's a dedicated machine, meaning you're not sharing with your teenager that's like playing Fortnite later, and we've done basic assessments against it. And then there's those words again, VPN. You got a VPN. Will, can you help me out? Because every time I try to explain a VPN to the layman, I end up getting a little techie. What would be the easiest, just simple way you have of explaining what I'm telling these folks they got to do?
So a VPN is as simple as just pretend like you're sitting in your office and you're on that company network. What a VPN does, it takes you from sitting at home and ties you into that corporate network, but it secures that connection. So when you go out to the internet from your home, you go to google.com, you search, that's just over the public internet. Anybody can capture that data. But with a VPN, it puts it in like a tunnel for you that it's encrypted and only the people that have access to that tunnel can see that. That's probably the simplest way to explain it. But, Paul, something that you brought up about in having backups and encryption on a home machine, how for the business owners or the doctors on the call, or even the nurses or whoever else is on this call, how can you require a home computer to have certain type of software as a business owner? How can you require your employees to modify their personal devices for business?
That's a valid question, and one we run into a lot. Every business needs to make their own decision. Okay. Some businesses will err on the side of privacy of their employees. You have employees that are extremely concerned about privacy. So legally speaking, you can mandate that they have the security products there. You can even do what we're doing, which validates that, for example, doing a quick remote session, I see that Norton, okay, it's Norton, but I see it's active. It's a good subscription. You've honored the spirit of the law. You've made sure that what they have there is at bare minimum protected, right? If they're going to have EPHI, it's their risk as much as it's yours. You're mandating that they have the encryption. Now, what you can't or probably don't want to mandate on personal computers is that you have management access to their computers. This is where the violation of privacy comes in. So I think it's a reasonable expectation in the modern world that in order to access my systems and have your job, you have some basic security mechanisms in place. I don't think you have to go so far as to mandating that some of the tools that you guys would put on, like at the office, get it put on every work computer out there, right? Because to your point, you have the keys to the kingdom. I don't know that I'm giving you the keys to my house. So there's a fine line to draw, and I think you guys have done a really good job of it, where it's really about validating that the environment is at its core safe. And then I'll throw back out there your really risky employees, like look at your own risk. The ones that are really high risk, maybe that's the one you need to go ahead and buy a laptop for, right? There are circumstances where you just need a business-owned computer. So carefully, and with respect to the employee's privacy when at all possible.
Sure. So, Paul, we have about 11 minutes.
Yep.
So let's start
We
wrapping
got to roll.
and as well as so we can have some time for some questions.
Well, so what I'm going to say now is that basically, if you take a look at it, you tell your employees what to do, you give them the basics, all these things you've done. Remember that slide I showed earlier that said what you're supposed to have for telehealth? It's the same thing everywhere you go. Guys, you have to have this at your office. All these roles, you got to have them at your home. You got to have them on the telehealth platforms that you're working with, because those same fundamentals of HIPAA we talked about in the beginning, they never change. But these are the IT controls. Realize there's also the business aspects of it. Now, to Will's point, we only have a few minutes left, and it's a 1,000-page law. So I'm not going to now give a giant lesson on HIPAA. I want to bring this home in a very real sense. Guys, if you're only doing IT, and the only thing that's happened is you called what we call trunk slammer down the street, and he came in and he threw in a firewall and maybe did antivirus. He called you HIPAA compliant, even did your assessments. IT lives inside the security rule of HIPAA, and it's a part of it, but it's only 1/3 of the security rule. See, there's the privacy rule, and there's the omnibus rule, and there's the security rule. And I'll give you a big hint back to that whole Algebra 2 thing. There is an audit for every single thing you see here, the rules themselves and the sub rules. There's 6 total audits or assessments that have to be done. So if the only thing you're doing is just that security rule, it's kind of like trying to do HIPAA light, okay? So to answer that one, I think best earlier, the great question, what happens if I only do part? Well, HIPAA light is like saying I bought antivirus and I'm safe. I mean, against viruses that they've already identified, sure. There's a hell of a lot more to this in IT security than just antivirus. What it takes to comply is a marathon, a system, a repeatable cycle that does all the audits and hits absolutely everything. It takes a methodology that allows you to show you've done everything, or you're going to fail your audit. HIPAA Lite is like my Algebra 2 test. It's just the stuff you didn't do and a reason for them to put red ink on the page. What we've done at Compliancy Group and what we do with partners like Vector Choice and their downstream partners, we've developed a methodology for delivering absolutely everything. We call it our Achieve, Illustrate, and Maintain methodology. Achieving means the The illustration is the reporting under audit, or the ability to show your team and your people what their jobs are. And the maintenance is the ongoing aspect of this that never changes, so that if an incident ever happens, you can immediately demonstrate your compliance. We do all of the audits, all of the remediation, all of the policies, all of the procedures, all of the training, all of the agreements, and all of the incident management on a yearly basis. It takes running, we call it the wheel. It takes moving in a cycle to successfully say you're HIPAA compliant. So if you come out of this today and you got nothing else out of our talk, and you say, what was I supposed to take home? I'm going to tell you that things changed for you in March of last year. Before, or March of this year, before you worked from your office, nobody was allowed to do telehealth. You didn't have nurses banging away on computers at home, but you do now. And if you didn't document it and you didn't train it, then they're not allowed to do it. Without the right policies and procedures, and without all the administrative controls and assessments, it's a no to everything that changed. You have to adjust your environment to be able to show your work. And I'll throw one more out there, guys. All tools, all vendors, and all partners are not created equally. You need to be working with the vendors that take it as seriously as we do. You need to be working with the people that understand it at a level like Will, and you need to use tools like the versions that are of these platforms that are compliant, the endpoint protection he's talking about, to be able to make sure you're compliant. This is a huge undertaking. Now, we've simplified it. We've made it easier. With a partner like Will, your investment intellectually and overhead wise is almost non-existent. We're going to give you a couple of tools coming out of this. You can go to Will's site and get them. One of them is our HIPAA compliance checklist. Don't let it freak you out, just complete it. Go on it and see how you're doing today. I'm going to tell you at the very beginning right there, there's one that says, how did you do on your high-tech Subtitle D privacy audit this year? If you don't know what that is, you need to reach out to Vector Choice and talk to them about this immediately, because that one question right there, if you can't click that box, you don't have to finish the rest of it. I can tell you, you're not compliant. Now, Will, what do you think? You think we gave them some stuff to talk about when they go home today?
Yeah, I hope so. I hope we didn't scare you to death, but I hope it at least educates you guys on what the risks are out there and why to actually be HIPAA compliant. You know, some of the resources, if you want the compliancy checklist, you can go to the link down at the bottom. If you want any resources, any tech tips that we do Tech Tip Tuesday every single Tuesday. That goes on our tech tip page. And also we're blogging about different, educating you on different things. And also we do Friday, Cyber Friday, that we send emails out and just educating you on what is going out there on cyber issues as well. So Logan, I know we've got about 5 minutes to wrap up. Do we have any questions?
Yeah, we do have a couple of questions. I also just put the link in the chat to everyone for the compliance checklist as well. So one question is, what causes a HIPAA audit?
Well, if it's okay, I'll take that one.
Yeah.
It's kind of a 1, 2, 3 thing. There's an incident, which requires a report, which results in an investigation, which results in an audit. So if you have an incident and you turn it in and they come in and investigate, and they quickly can tell through, you know, like our average audit response is about 400 pages, or incident response is about 400 pages of documentation we turn over, they might move forward into an audit. But during the initial investigation, if they uncover anything out of whack, it immediately converts into an audit.
Okay. And will they, and this is a question I wanted just you to educate the audience, is will they ever do a audit or ad hoc audit where they just come in and say, okay, I'm doing an audit on you? Does it have to trigger incident?
Right now, that's not really the way that it's done. For the first time ever, the federal government actually just licensed a third party to start expanding their audits. And it is believed that in the future, there will be some audits that may not be created by an actual incident. But right now, it usually is an incident. And by the way, guys, an incident does not mean a breach. I can be irritated with you when I walk out of your clinic today, can call a phone number and say, hey, they threw away my medical record in the trash can. There will be an investigation because I said that, whether it actually took place or not. Any reported incident requires a legal investigation.
Yeah, that's definitely good to know for especially all the healthcare providers out there. Logan, anything else? And guys, we have a few more minutes. If you have any questions, please put that in the Q&A.
Yeah, we did have one question. Will we be sending out this video? And we can post out the YouTube link of the recording of this video. But the last question is, I use Office 365 for all PHI storage. This means that I have covered the backup requirements, correct?
Ooh, well, you take that. This makes me nuts.
Exactly. So, well, let me answer the first about the video. So it is on Facebook Live right now, but it also is being recorded. It will be uploaded to YouTube and it will be put on our website. So you can go and share this and have other people watch it as well. But to answer that question, I'm actually, it's funny that someone asked that, Logan, is that we are actually doing a webinar next week about Office 365 backup, because don't think that something's in the cloud. And I don't care about, it's not just Office 365, but anything that you put in the cloud, don't assume that it's being backed up. You need to ask your provider, how do you back up? Are you backing up the data? Because sometimes it's not. They're a host to you, but they're not a backup. So just like Office 365, there's a period that they will hold the data. I think it's 30 days, I believe, on if you delete it, but it's not truly being backed up. So no, Office 365, Teams, OneDrive is not being backed up just because it's in the cloud. But
Yep.
again, I'm going to be covering a lot of that and sort of how to do that with cloud tools and Office 365 next Thursday or Friday. And we'll,
24th. Yeah, I also put that link in the chat as well
okay.
for people to go and register.
Okay. Yep. Great. Great.
That's going to be a good one.
Yep.
I'll have to tell myself.
Anything else, Logan?
Nope, that was all.
All right, guys. Well, thank you so much, Paul. I hope you guys enjoy Paul sharing that information with you. If you're interested, the numbers popped up before, but you can just reach out to us if you just want to go to our website and find our numbers. If you didn't write that down, you can reach out to me directly, and we can help you. We work with Compliancy Group a lot of times with our managed services package that we provide our customers. We actually, if you're a healthcare, we actually put the HIPAA Compliancy Group as part of the managed services package by default, because we believe there is a need to make sure you're secure and make sure that we're covered helping you protect yourself and your patients. Again, Paul, thank you so much for joining us, and everybody, thank you from Facebook as well as on the Zoom webinar here. Thank you for joining us, and you guys have a wonderful rest of the day and a wonderful weekend.
Well, Logan, thanks again for having me, guys. I had a blast. I really appreciate it. To everyone out there, have a great weekend.